neuroscience and neurodegenerative disease. He is also trained in cognitive behavioral psychotherapy. He was worked as psychologist at the first university department of neurology in Aristotle University, where he has performed neuropsychological assessment on people with cognitive impairment, a patient with multiple sclerosis. Currently, he is a psychologist, a cognitive behavioral psychotherapist working in Greek Association of Alzheimer disease and related disorder. You can start.
Thank you very much. Hi, everyone. I will present you the benefits of pomegranate seed oil in mild cognitive impairment. It is a clinical trial that we conduct in our facilities in the Greek Association of Alzheimer's disease and related disorders with the help of Popstar Rodi Elas. So, to start, I will speak about the benefits in general of pomegranate in memory. The most important is the antioxidant nutrients. Polyphenols in pomegranate juice may prevent neuronal damage from the free radicals produced during normal metabolism. Daily consumption of pomegranate juice may stabilize the ability to maintain visual information and parts of working memory over a 12 months period. And this is a clinical trial, a randomized clinical trial at 2020. So it is very new. And the phytonutrients, such as pomegranate elagitannins, may reduce oxidative stress and inflammatory. So especially the pomegranate seed oil, it is produced by the seeds of the fruit, and the procedure is below. At first, we clean off pomegranates and isolate the aerials. Then follows the production of pomegranate juice naturally with pressing methods, and then isolation of the seeds, which are dried by natural methods, air and the sun. With cold pressing, which is a natural method, the pomegranate seed oil is produced. Then it is stored in 30 ml dark bottles. The benefits of pomegranate seed oil in the brain are many. At first, antioxidant effects. It enhances the levels of antioxidant enzymes, reduces lipid peroxidation, free radical addition to one of conjugated double bonds of linolenic acid, inhibits TNFA, induced priming of ROS production, and mieloperoxidase. It upregulates the colonic peroxisome activated receptor D. And the anti-inflammatory effects, it increases the levels of interleukin-17 and interferon gamma, modulates mucosal immune responses, reduces the expression of TNFA and interleukin-6. Also, the benefits are that it reduces hepatic and plasma triglycerides, and it has anti-diabetic effects. The last 2 points are risk factor for dementia and Alzheimer's disease. So by preventing risk factors, it helps indirectly to the prevention of the disease with this way. And the effects on memory, it is that it has high concentration of polyphenols, and the administration of pomegranate seed oil on permanent cerebral ischemia causes a remarkable improvement with criterion decision responses in Y maze and step-through latency in two-way shuttle box. In this study, they used passive and active avoidance tasks with rats. Pomegranate seed oil ameliorated with bilateral common carotid arteries occlusion. So we started a study with pomegranate seed oil. The guidance was the patients to take 5 drops every day, and this amount of drops is a guidance from previous studies. And the primary objective was to measure the effects of pomegranate seed oil on cognition of mild cognitive impairment patients after 6 months of treatment. So the hypothesis was that the participants of experimental group who will take pomegranate seed oil will have better performance than the participants of the control group. The methods. This is a randomized clinical trial, a single-blind randomized clinical trial. It is registered on clinicaltrials.gov, and we use ongoing randomization. 100 participants with a diagnosis of mild cognitive impairment. 50 of them followed Mediterranean diet as a control group. And why we did that? Because Mediterranean diet is known that helps in the brain and in the prevention of Alzheimer's disease. And we want a stable baseline to compare, because to control this factor. And the experimental group had 50 patients who took pomegranate seed oil at Mediterranean diet. The procedure, we had an examination of apolipoprotein E allele, a neuropsychological examination, evaluation of blood biomarkers, follow-up after 6 months and 1 year of treatment. As far as the neuropsychological assessment, because the most time of the talk will be dedicated to neuropsychological assessment, we use mini-mental state examination, Montreal cognitive assessment. These are for global cognition screening tests. We used Ray auditory verbal learning test that is a test for the evaluation of episodic memory and the ability of learning. The Ray complex figure test, it is about visual episodic memory test, and ADAScope, which is a global screening test about the functionality, cognition, and the functional cognitive assessment scale, which is about functionality, and trail making test B, which is about working memory, and the clinical dementia rating. So the results, we did intra-group comparisons with Wilcoxon-signed ranks test and intra-group comparisons with independent samples T test. We can see the results from the intra-group comparison, the statistical significant. We had statistical significant results, as you can see, in the trail making test B, where we had the control group saw that they had more deficits after 6 months, and the experimental group we have seen a progress. Ray auditory verbal learning test and Ray auditory verbal learning test, the recall task. So in the inter-group comparisons, you can see at this diagram, the blue line is the experimental group, and in a trail making test B, we measure the seconds that are needed to complete the task. So you see that the experimental group started at approximately 184 seconds, and then the processing speed fell to approximately 178 seconds. But we see that in control group, it was not statistically significant, but we saw an increase of processing time. We continue with intergroup comparisons in Ray auditory verbal learning test. Again, in this time, we have regular scoring, not reversing scoring like before. So with the blue line, we see that we see the statistical significant progress of experimental group and the deficit and of the control group. In Ray auditory verbal learning test, the recall task, here we didn't have any significant, statistically significant result or increase at the experimental group. They were stable, but we saw statistical significant deficits in control group. So here we saw that stabilize the patients. So yesterday we had the blood biomarkers analysis by the Department of Biochemistry of Aristotle University of Thessaloniki, and many thanks to Professor Padazaki for their contribution. So the statistical analysis and graph are conducted with GraphPad Prismate. They used many complex statistical methods that it is difficult to pronounce now, and to examine possible discrimination for biomarkers levels between baseline and with or without intervention. A Kruskal-Wallis test was conducted for multiple comparisons. These are some of the results. There are some, we have sent some other samples for other clinical studies too, but you can focus on the pomegranate seed oil before and pomegranate after can contribute to the reduction of phospho-tau. We know that the phosphorylation of tau protein is a key characteristic of neurodegeneration in Alzheimer's disease. So in this way, it is shown that it can help to the prevalence and prevention of the disease. So also we have results about only ApoE4 carriers. We know that ApoE4 is a gene that can impact the progress of the disease. So that's why at the method of the study, we separated and we did apolipoprotein E examination. For ApoE4, if someone has the ApoE4 one time, has 2 or 3 times more possibilities to develop Alzheimer's, and if someone has it 2 times, has 10 times more possibilities to develop Alzheimer's disease. So in ApoE4 patients, we saw that the group 1 is the experimental group, and we didn't have statistical significant results, even though they had the progress. But we saw that the group 2, that is the control group, had a statistical significant deficit. And we can see that at these intergroup comparisons we did with the blue line. Before I explain that, I want to say that ADASCOG has a reverse scoring again. It's like trail making test B. So we want to be low, the scores of the tests. So we see that the experimental group, it was not statistically significant, but we see that the score went lower. But oppositely at control group, we see a statistical significant increase in the score. So in the discussion, the results of the present study confirmed the findings of previous study on laboratory animals supporting that pomegranate seed oil has positive effects on memory. We confirmed the benefits of punicic acids and lanolenic acid, which are compounds of pomegranate seed oil and have anti-inflammatory and immunomodulatory effects revealed by many studies. There was improvement in CDR, ray complex figure test, and ADAS-Cog too, but they were not statistically significant, and that's why I discuss them now and not at the results section. However, the results of this test may be statistically significant in the examination after 1 year of treatment. Regarding the ApoE E4 carriers, there was improvement in trail making test B2, but again, it was statistically significant. Conclusions. Pomegranate seed oil, when it is used by mild cognitive impairment patients, improves the performance of short-term and long-term verbal episodic memory measured by ray auditory verbal learning test, the processing speed and working memory measured by trail making test B. Also, it can maintain the long-term memory capacity measured by the ray auditory verbal learning test, the recall task. In ApoE E4 carriers, it can maintain cognitive functioning measured by ADAS-Cog. So it can be a very useful treatment for prevention of Alzheimer's disease, and it can be used in holistic treatments of the disease. Some bibliography. Thank you very much.
Thank you very much, Mr. Chatzikostopoulos. Now I would like to thank my PhD student, Elena Zekaki, that performed the experiments for blood markers, phosphorylated protein. She is here, there. She's there. Thank you. Thank you. You have to say something about the experiment? Very preliminary. Okay, thank you, Elena. There is any question?
Excuse me, it is an ongoing study, so our goal is to recruit more patients to reach 200-300 patients yeah. It is under publication in Brain Sciences.
Okay.
Yeah, at the journal.
Great. I just wanted to ask about your statistics. Did you compare group to group or each patient to itself?
The group to group.
So you don't compare what happened to each person that gets, because this is what we are doing. We compare, we take each person and compare it 0, 3, 6, and 12 months. And then after we do this, then we compare group to group.
We did that with the intra-group comparisons with Wilcoxon sign tracks test. I will go back. Wilcoxon. Then we saw that the intra-group comparisons were, these are the intra-group comparisons. So we compare the patients at the progress of the time to each other, one by one.
Yeah.
Yep.
Okay. Yeah,
and then nice. we proceeded to intergroup comparisons with comparing the two separate groups.
First of all, thank you very much to Thanos and to Professor Gabison. I'm proud to hear your lecture, as we are from the same country, and she's well known as one of the best scientists we have in Israel. But I really am not from this profession, and I didn't understand so many things, especially Professor Gabison's lecture. And I have one simple question. Is one drop of natural pomegranate seed oil is exactly like one drop of Granada gran that yes, thank you, that you are putting in one capsule? And if yes, in what they are differ? If not,
use the microphone to hear you.
Yeah. Obviously, I cannot say. I mean, in our hands, we don't know about human, but in our hands and in the hands of actually all the people that did the pomegranate seed oil, I mean, the snake gourd PA, it doesn't go into the brain. So this is actually the discussion we have here. But I'm happy that his results are as it looks. Then it means ours should be better. That's what. Yeah, because it's a question of quantity and how much can you get into the brain. And of course, you know, it's not the same patients, different thing. So this is the pomegranate seed oil that you make in your lab? Or what are these people getting?
The pomegranate seed oil,
yeah,
is produced by Pomstar Rodi Elas with natural way. All the procedures are natural.
Yeah, and so, are they getting the same? Are you testing oxidation effects? Or, I mean, is the same bottle? For how long are they getting it?
About 1 month.
Each month they're changing the bottle, or?
Yeah.
Okay.
They came here, they came to us, and we give them a new bottle.
I see.
Each drop, in each drop, how many ml? Mm-hmm.
No, they don't get capsules.
No, for you. The question is for you.
For us.
Yes.
For us, we have 400 microliter in each capsule, and only 120 microliter is the oil, and the other are the emulsification.
120.
20 microliter, and the other are the emulsifiers. Yes. I don't know. Each capsule is 400 microliter. Yes.
It is a concentrated compound, or?
It's 400 microliter that has oil and the 2 anti-emulsifiers.
I wanted to ask Professor Gabison a question about your speech. I don't know, because I'm not involved with chemistry or that stuff. How it can be done for a capsule for the pomegranate oil to keep its natural structure in the capsule.
That's no problem. It's done. You have many compounds, many pomegranate seed oils in different capsules. Actually, the moment you put it inside the capsule, we know it stays the same chemistry. It doesn't oxidize for 3 years.
3 years?
Yes. This we have tested. It's the same concentration of punicic acid. And if you don't keep it in the capsule, then it doesn't stay like this for. So if you want to standardize what you're doing, you should do it this way. You cannot just keep it liquid and open it every time, because each time you open this capsule, it's not the same.
Okay.
The bottle.
Okay, thank you very much both